So, you know, I come from around Detroit, Michigan. Detroit Tigers were a big team, you know. They're still a pretty darn big team. But growing up, it was interesting because, you know, we lived on a whole acre. And I had to sit down and ride this lawnmower to cut the grass. It took me about an hour and a half. I remember my butt would be numb after that hour and a half of cutting the grass. I said there had to be something better in life, so I went on to Davenport, Iowa, where I went to chiropractic school after getting my bachelor's degree in biology in a northern Michigan school that was primarily, the specialty was pharmacy. So all my friends were pharmacists, and they said, Mike, you study your butt off, why don't you become a pharmacist? I said, you know what? Your wish and desire is to open up a little mom and pop pharmacy store. I don't want to be giving out drugs. So when I went back to Michigan after getting my degree, it was actually going in my master's, and that was in OSHA. Remember OSHA? Yeah, they're still around, water treatment and all that. And I really didn't have much of a passion in that. And then I talked to some buddies that had been chiropractors, and that's where I go, wow, you know, you guys are doing this natural stuff. You're not, you know, dealing with the drugs. You're working on helping these individuals to regain their health naturally. And so it was then that I decided to kind of get into chiropractic. And previous, at 15 years of age, I had an injury where I was doing some, you know, shoveling some stones for my dad. He had some buildings that we were working on. I had to re-roof them and do all these different things. And so I had a pleasant experience back then. At 15 years of age, I made the decision to look in the yellow pages and search out a chiropractor, not my parents. Well, the problem was a chiropractor educated me, but he never educated my parents to understand really what's going on. So that kind of hit home. Today, we educate our patients about health. But today is a lot different than back then because people don't heal very well. Why don't they heal? Well, it's stuff, you know, in our environment, it's the food that we eat, it's all these different things. I had a gal the other day, 20 years of age, that was referred in by a workers' comp insurance company, and I was surprised, you know, because they're not likely to do that much, but they heard about a reputation, and so they're wondering, why is this girl 5 months post-injury still in pain? Well, after doing a major discovery, consultation and all that, she's got a thyroid problem in the development. What does that mean? Well, that means her body is so inflamed, it's not able to heal itself. And so one chiropractor said that the girl had a disc problem. The insurance company didn't want to hear that. That's when they referred her over us. What are we doing? Well, now we're modifying her diet, doing special things like non-surgical decompression to help her get well. She's been in her care about 2 visits, and she's already noticing improvement where no doctor has really done anything. Even the orthopedist that evaluated her ran his fingers down her legs and said, can you feel that? She goes, yeah, I think I can feel that. When I did the evaluation on her, I tested the muscle strength. I went ahead and did pinwheels, these pinwheels that you could feel. She couldn't feel on the right side. She couldn't feel it. It felt smooth. I said, tell me, because they're not looking at me while I'm doing this. Tell me, how are you feeling this? She wasn't feeling it on the right side. So what do we know? Well, we know that there's interruption of the nerve supply from that lower back, that area going down the legs. That's an inflammatory process going on in the body. Her body's not healing. Mark knows that people that have gum disease, eventually they have a higher likelihood of having heart disease. It's all been in the literature. But it's not just ending with heart disease. We're talking about cancers, we're talking about arthritis, we're talking about COPD. You know what that is? Chronic obstructive pulmonary disease. We're talking about asthma. We're talking all these different things that it's a bigger picture. It's not this small picture. When I look at someone that's got gum disease, I know they got spinal degeneration, they got arthritis, they got discs that are deteriorating big time. When that happens, boy, they're a whole ball of mess, and it's a real sad state of affairs because what's being given to them? It's just drugs. Prednisone. You heard of prednisone? Prednisone's a nasty drug. Yeah, is it life-saving? Yeah, at times, but why not eventually get to the cause of the problem, fix the person to get them well? Because the body's designed to heal itself. Otherwise, when you cut yourself, you'd bleed to death. When you take one aspirin and within a 24-hour period of time, you delayed the body's ability to clot by 1.5 minutes to over 7 minutes. This aspirin a day, right, is recommended? It's crazy. Why not exercise? Why not have the fish oils? A lot of the fish oils, if you get buying good quality fish oils, you're improving the circulation, you're improving blood flow. So there's a lot to understanding this. I study with different doctors, PhD, medical doctors. I do a test that measures antioxidant levels through urine, because the urine they find is the best way to evaluate how toxic we are. The second most important nerve in the body as far as discovering toxicity is the optic nerve, your eyes, okay? And that's what I do, a visual contrast study that was developed by a Dr. Scott Whitehead, and he does a lot with mold because of the water damage. That's where a lot of people are developing fungus and lung type of problems because of that exposure. So that gives you a little bit of an idea what we do. Anyone that has chronic problems, anyone that is not getting well, that's who we can help. So I'll open up to questions. Any questions at all?
Go ahead. You brought up fish oil. I was taking fish oil for a while. My wife said, stop taking the fish oil. They said it's bad for you.
70% are rancid.
Oh, okay.
70% of fish oils are rancid. So when we look at the fish oils, it's all about quality. You know, like Sally was talking about Costco. God, I know the people that manufacture that, you know, a lot of their products for Costco. I mean, you don't want to be taking that stuff. That's kind of nasty. So there's things for like calming down the brain. You know, what we've had patients with blood pressure problems. We're driving their blood pressure down 70 points, 30 points, all getting them off the medications, you know, through the advent of different type of things. Improving the breathing is awesome. We had a patient, he's had lung cancer. He's got COPD. He's been on this particular protocol of ours for 2 weeks, and he's already noticing improvement. Big time improvement. This guy's on oxygen. Any other questions at all? Okay, that's it.